Can I ask your name?
Yes, my name is Benjamin Summer.
Benjamin Sommer.
Yeah. They know that I do this work, from Wall of Peace. So they bring the emissions to me and I buy it. And I get them from Lofa County. Transfer it to some souvenir, let's see, from Wall of Peace. It's a church. See, it is tedious, but I want to create something.
Yeah.
That's right.
My name is Jerry Tamatila. I hail from Lofa County, Foya district to be exact. Foya district has been a food basket for the Republic of Liberia until 1990, when we had the national crisis, that is the war that befell us.
In fact, the fighting that took place here is more than all over in Liberia, because fighters crossed from over from Sierra Leone to fight here, Guinea to fight here in Liberia, so Foya had really been destroyed.
Wherever they met a resistance, and that place was crushed and the people could not stand it. So about 80% of the population of the district left the area for refuge in other areas. They went for sanctuary.
I mean, we only have one hospital. The entire Foya district, we only have one doctor. Most of the relatives died. They killed them during the war and they left children. So I'm alone here. I'm catering to 17. Because most of the people that I knew, they killed their children. I could not allow seeing their children dying. So I had to use my maker resources to bring them up. That's why you saw them with many. Some of them, the father had 2 wives and they have 10 children. They killed the father and the mother. How you expect the children to live? The other families have to share the responsibility. That's why you see a lot of children with us.
So our plan for Foya is to have 4 days of medical clinic. I have 2 physicians. I have Dr. Nancy Schmidt, and she is an internist, and so she performs family medicine for children, teenagers, men and women. And then I have a pediatric specialist, Dr. Sue, and she's from the University of Virginia Hospital. She's just a leading in her field of pediatric care. And then we have 2 nurse practitioners, Gabby Ford and Margie Sennett. They have some expertise as well in terms of the pediatric. We have a skilled pharmacist who does clinics all around in poor areas of Virginia. She's the one who identified and got our medicine. And we did a lot of fundraising and got donations for our medicine and had to buy a tremendous amount of medicine. And then the 3-day clinic at Lot Carey, we went through so many medicines. We did 1,000 prescriptions a day, which is almost inhuman without a computer and with one pharmacist and a pharmacy technician, and then just volunteers helping. So that's our mission, that's our agenda, and I think we're ready for Foya. Area is to address things like typhoid, malaria, upper respiratory infections, ear, eye, nose, throat infections, skin rashes. We've seen a lot of sexually transmitted diseases. We've seen a lot of urinary tract infection. We've seen wound infections secondary to other. We've seen a lot of gastroenteritis and needed a lot of deworming for almost everyone we saw. We were able to provide deworming medicine. We've seen some chronic things like headaches and some arthritis, and we do have some medicine for people with high blood pressure, but Primarily, we're looking for remedies that we can address because people are ill, sick, fever, or abdominal pain that also could be related primarily to worms.
You came from very far away?
Yeah.
Yeah.
I'm from Sao Paulo,
How far is that?
the village. 140.
Okay. Yeah, Grand Coli.
Town.
And how far is that?
Yes.
It's about 25 kilometers.
25 kilometers.
How many days did it take you to get here?
You can take one day and a half.
I serve as a pediatric oncologist, a doctor for children with cancer here at the University of Virginia. And Gabby had something in her thoughts that this probably was looking like a child with a lymphoma or a cancer and brought me to the little girl's attention. They do not have therapy and medical therapy for all treatments for sure, including cancers.
Some of the children that came in that were just extremely malnourished, and we knew on with some of those children they would not have lived another day without the rehydration we give them, without the antibiotics that we had to give them. And then there were a few of the children who I knew would not live regardless what we did for them. And one of the babies that I took care of was just covered in abscesses. And although she only looked like she was 9 months old, she was actually 15 months old. And I knew that she would not live regardless of what we did for her.
We saw 424 people today, 244 kids, 180 adults. Big number.
Yes, big number. And how many prescriptions?
We haven't even counted yet, but the stack wouldn't even fit in a paper bag.
I'm sure it's over 1,000.
So let's do this.
Well over.
Ready?
It was the second to last day in the interior, and I was really struggling that afternoon because it seemed like while there were so many patients that we did help, there were so many that had problems that we couldn't do anything for. Just got through that afternoon, and then the next morning we had to go and do our last clinic, and it was during the devotions that the team was having, and I was really crying out to God saying, I don't know if I can go do this for one more day because yesterday was so hard. And Mary writes prayer cards that we read that day. Amazing. Divinely inspired for me because it was Galatians 6:9 and it says, don't grow weary in doing good, for in due time you'll reap a harvest. And
I remember the one man that you treated, young man that had a leg wound from the war.
Right. Yes. So how's your leg doing today? Is your foot any better today? No. Yeah.
He came by every day to thank you.
Right.
He'd sit and park outside the door to our room and just be there smiling, just looking at us throughout the day.
Looking at the need, like we saw, especially the health need of our people, because sometimes we make spiritual reach out to the people, but if the physical is not there, they get to believe that they are hoping, but when do they see the light? And seeing the light, in a sense, when you pray, you see signs. The mission that came truly to them.
We pray so that the Lord can give us the strength so that we can plant more churches. I only want to serve as a missionary to plant and develop churches, I don't want to be assigned to one church or sitting down. Pretty soon we want to finish with Lofa County, we cross over to Australia and Guinea. If the Lord give us the logistics, well, I'm prepared for that. I committed my life, throughout my life for that purpose.